So yes, great. I think all the applicants are due to be here with us are with us now. Um, so it says just me there. This was another thing that we were doing the other day for the University of Manchester final year students because we were invited to present there. But everyone who's here, we understand you're offer holders, and we wanted to take some time to share with you more about the course. Welcome. We're delighted to have you here. My name is Henok Tadesse. I'm one of the co-directors of the Master of Public Health course. I'm a principal teaching fellow in public health. Besides co-directing the Master of Public Health with Anthony Laverty here, I lead a few of the modules on the course: research methods, commercial determinants of health, and health policy. Um, and my own background is in public health for my undergraduate degree, postgraduate degree in public health. Again, studied public health as an international student in the UK, in Denmark, and completed my PhD back at the University of Sheffield. And I've been a course organizer on the MPH and progressively as co-director of the program for the last 10 years. So very happy to be here and to discuss the program with you. Over to you, Anthony.
Great, thanks. Yeah, similarly, yeah, it's great to see everyone. It's great there's lots of interest, and I'm Anthony Laverty, the other co-director of the MPH, along with Henok, and I am. Yeah, I have a background really in, I worked in public sector data analysis job for a little while, but I joined Imperial about 15 years ago, way back as sort of research assistant. I've worked in sort of range of research and teaching things through that time, did a PhD around trying to improve health system performance, worked on sort of transport and health issues, what happens when you subsidize travel for older people, what happens when you try to change nutritional policy, and so still work a lot on transport, also on tobacco control, and teach a few modules, one with Henok and with some other people on the MPH. And yeah, delighted to see everyone here. Should we have all introductions now, Henok? Is that what you were thinking?
Yes, I think that would be great. So to say, we've invited some current students and one alum from the year before who's graduated from our course, Sami. So we can start with you, Sami. Just a brief introduction to yourself, please.
Hi everyone, it's nice seeing you all. My name is Samil Talib. I completed Baccalaureate of Medicine and Surgery in Sudan, and then I practiced as medical doctor back in Sudan. I worked then in Doctors Without Borders and Ministry of Health. Then I moved to the UK to do my master, the Master of Public Health, 2022 to 2023, with Chevening Scholarship. Then now I'm working as research assistant at the Self-Care Academic Research Unit as part of Primary Care and Public Health at Imperial College London. Thank you so much.
Great. Thank you so much, Sami. And on my screen, it's you next, Holly, please.
Hi, yeah, I'm Holly. Really nice to be here today with you all. I am a current MPH student at Imperial, so I started in September last year. I have a background in biology, and I previously worked in a market and social research firm in healthcare. And at the moment, I'm kind of exploring interests in non-communicable diseases, like obesity and oncology, and the impact of environmental factors on these. And I'm also interested in health literacy. Shall I pass over to Ankita?
Yes, great. Thanks, Holly.
Thank you.
Hi everyone, my name's Ankita Mishra. I'm from India, and just like Sami, I too did my MBBS from India, so I'm a medical doctor. I worked in India for 2 years. This was at the height of COVID as well, so it was very informative in me choosing to do this degree, even though this degree was something I've wanted to do my entire life, because I feel like what it stands for is extremely important. But yeah, so I worked for 2 years, and then I came last year to just like Holly in September to pursue my MPH, and I am looking to continue to do clinical practice, but to find ways that my MPH learnings and my interests can sort of intersperse through them, because I'm sure a few of you would be doctors, would be dentists, but every single clinical disease is of public health importance in some way or the other, and it's kind of our duty to as medical professionals to kind of learn that. So this degree has helped me do that, and it's something I hope to pursue in the future. And thanks to Henrik and Anthony, a huge interest in health policy now. So yeah, that's about me. Over to
Thanks so
Siwan.
much, Ankita. Thank you so much. Yes, Sion, please, you're next.
Hello, can you hear me? Yeah.
Yes, we can
So,
hear.
yeah, I'm from China, and my background is in public health. I completed a 5-year preventive medicine undergraduate program at Capital Medical University in China, and right after graduating, I went straight into this MPH at Imperial. So it's been a very natural and well-aligned progression for me, no switching fields or disciplines. And during my undergraduate years, I had already published a few papers, research on the mental health and behavioral health. And I've also been preparing my PhD applications during my MPH study. And I'm very happy here to share my experience, a very intense but rewarding journey so far. Yeah, that's it.
Fantastic. Thank you so much, Sion. Yeah, thank you all. So for today, usually we'd go through a number of slides to give a background to the program, to Imperial College as a university. But we thought today, because we've got our students with us, it might be more interesting for all who are attending to hear from our students. So we're going to cut down the presentation from our sides. So what we've resolved is just to do the program overview, which starts a few slides later. Anthony, if you could go there to the structure, to the program structure. So I'll give you an overview of what your year with us is going to be like very quickly, and then we would we will ask our students some questions to reflect on their year with us, and we want to dwell more on the questions you might have, because we understand a lot of you here are offer holders. So you'd have considered the program, you've looked at the major important bits already. And if you've got questions, please put them in the Q&A, and we'll pick up the questions. There's a team that's replying to you, our programs coordinator, Joe Tite is replying to you as we speak, and we will also pick out some of those questions to discuss in the main forum. So this is our course structure in a nutshell, right? So you've got 3 terms on the 1-year course MPH with us. The first term is straightforward, some of the key compulsory modules in public health, what we call the bigger modules. So you've got about 10 weeks dedicated to the first term. As soon as you arrive, we have a 1-week induction week, and then we go into these modules. And our modules are organized as one module per day. So it's a full day affair where you'd be engaged in each module per day, and these run for 10 weeks. So we've got 4 modules: biostatistics, epidemiology, research methods, and the foundations of public health practice. So this would be your first term. These are core topics in public health. And so the way we structure our courses is that you've got the whole day dedicated to the module. It doesn't mean that you're constantly in lectures. What happens is there's time dedicated for tutorials, there's time dedicated for independent study, because we've got this hybrid approach to teaching, which is pedagogically proven to be very effective, where we ask you to undertake your own learning on our online, well-curated materials, online lectures, some reading materials we've curated for each day. You complete those, the basics around the concept to be discussed during the day. You come to class and we engage in more interactive discussions in class. And then there's additional tasks to be completed after that, such as, for instance, for research methods, you go into your groups to complete your group work, which is part of your assessment. So the first day actually is introduction to statistical thinking and data analysis on Monday. On Tuesdays, you've got principles and methods of epidemiology. And then Wednesday mornings, it's extracurricular seminars we organize around academic skills and additional seminars around statistical methods and so forth in the morning. The afternoon is actually we can't schedule classes in the afternoon. The college, across college for students, it's time to engage in extracurricular activities, sports, other interests that you may want to pursue. On Thursdays, it's research methods. And again, it's partly independent study, it's partly lectures in the class, interactive sessions, and partly group work. And foundations of public health practice similarly, right? So it's intensive. The whole week will be intensive, each day dedicated to each module. So everyone undertakes these modules. There's no choice here. These are the compulsory modules that we've got here. And then we go to the second term, which is our busy slide here. We've got about 20 modules to choose from, organized under different streams or concentrations. There's going to be some changes for next year because so far, for you to qualify for a specific stream, you only needed to undertake 2 modules. For next year, we are tightening that criteria, and we're saying you need to undertake at least 3 modules which have been assigned under the stream. So we've got dedicated streams for a stream for health promotion and service improvement, global health stream, environmental health stream, quantitative method stream, health policy and system stream, and infectious diseases stream. Or you might just decide to say, I'm not interested in the stream, I'll just take the general MPH, multiple streams. I don't know if any of you here have done that, but every year about 10 students out of a total of 190 students kind of opt for the general MPH. But the overwhelmingly the streams are very, very popular. So this allows you to kind of concentrate your efforts in the topics that you want to build up on after the MPH. But individually, you can only take 6 modules in the second term. One of them is a compulsory module, which is health economics, and it's taught by the business school. So we've got 2 modules which are run by the business school. It's health economics and health policy and health systems policy and financing. We also run some modules so we've got this collaboration between Imperial Business School and the Imperial School of Public Health. So really, it's about the elective modules beyond health economics, the 5 modules that you choose, which will determine your stream designation, whichever stream you're interested in. And so you'd do that over 10 weeks, but these are shorter modules. So these are 5 weeks, but the principal stays, each day is dedicated to a single module. And it's, again, intensive, as our students here will tell you. It gets very busy because you've got to finish one of the modules over 5 weeks, and you move on to the second half of term where you'll undertake the other modules. But, just looking there, we can go to the next slide, Anthony. Thank you. because you can see there's quite a selection of modules to cater for this broad interest within public health, from quality improvement in healthcare and participatory approaches in public health, very timely things, digital health, to the more skill-based modules such as advanced statistics and data science, infectious disease modeling, and more global health related modules, global health innovations, global health challenge and governance, planetary health, exposure assessment. So what we're trying to do through this suite of elective modules is give you an opportunity to follow your particular interests within this broad church that public health is. But in any case, each of you would only have an opportunity to undertake 6 modules, so you'd have to make your choices there. And also, if you are interested in additional modules, we do have arrangements to ensure to enable you to sit in the classrooms, audit some of the modules. It will not be credit bearing, but you could pursue some of these additional modules if interested and if you can find time. And then we move on to the third term, which is wholly dedicated to the research project. And I would say this is the distinguishing aspect or a unique selling point for our program. We dedicate almost 4 months to the research project, and we set you up so that you are in a position to independently undertake your research project, supported by at least 2 supervisors. And maybe our students would, and especially Sami, who's already completed his project, can share some of his experiences. But so we generate numerous projects. I think this year, close to 200 projects were generated by academics across Imperial, which were made available to students to choose and select. And these are projects being curated from actual ongoing studies at Imperial. It could be data sets that our academics are working on here, and they carve out a student project there, or they just add a student to an aspect of the work that they are undertaking. It could involve some primary data collection. It could be a systematic review and meta-analysis type project. It could be a qualitative project, or it could be most usually it's an aspect of secondary data analysis, working with big data data sets on different topics. So essentially that completes your year at Imperial. And maybe a couple of slides to just highlight some of our approaches, just to say course assessments. We've got a variety of assessments. We are cutting down on some of the assessments for next year. We are going through that process right now because based on student feedback. But we've got quite different types of assessments in there to enable you to use the different skills sets. So it's not just academic essays, it's group work and presentation, it's video logs, it's reflective statements, simulations, but also engaging you in formative exercises. So you're in well state to undertake your final assessment, summative assessments. All of the assessment information is provided to you on module handbooks and the course assessment schedule, so that you're able to anticipate the kind of assessments. And these are well supported by the module leads and the different tutors on each module. And just maybe at this point to say something about the WHO trip. I think it's a few slides down if you can find it, but I could just say that we organize a trip to the World Health Organization and other agencies in Geneva every year. But given that our course has been fast expanding, we are not able to take everyone on this trip. So we manage every year about 30 or 35 students who could actually go physically to the trip. I don't know if any of our students here have had have been picked for it. But even if you're not, we make sure that some of the sessions there are transmitted, and you have opportunity to virtually attend, because it's not just visiting the institutions. They organize different seminars there, some career development sessions, advice sessions, and things especially linked to the UN agencies and so forth. But also this year, so in the picture, you've got Professor David Navarro, who's a special advisor to the Director General of the WHO, and Professor Salman Rawaf, who's the Director of the WHO Collaborating Center at Imperial. But so Professor Salman Rawaf and his team have been working on this additional trip for a while, and we are testing that, we're piloting that this year. So this is to the WHO Academy. This is a new institution in Lyon in France. So this is being piloted this year with our current students. So we've got 2 trips going this year, and we hope to continue on that from next year onwards. So it's about, we're on the 25 minutes mark. I'd like to conclude here, but maybe Anthony, if you'd like to add anything there to what I've presented, and then we can dedicate the rest of the time to our interview and discussions with our students.
Yeah, thanks. I think that I'll stop sharing. I think that yeah, that sort of highlights it nicely. I mean, the one thing I'd say about the course structure is, there's a lot to learn in public health, multidisciplinary science, really public health is everything. And so, there's a lot to learn. And so we're aiming for this mixture of teaching people the real core skills in term 1, and then, letting them either some people focus a bit and, they think, I'm really interested in this problem, I want to know as much about that as I can, or they sort of continue to have this sort of a broader exposure to lots of different things. So that's the sort of the overall rationale for this sort of mixed structure across the terms. But otherwise, I think we can, let our current and former students have their say.
Perfect. Thanks so much, Anthony. Yeah, so here is the space, and we will leave some time to pick up any of the questions in the end, so that we can all contribute to answering those. So this is the point where I ask you all to respond to reflect on what your experience has been before joining the MPage, and why you wanted to join the MPage, and how you feel you found it since you've joined us. So just in short, to kind of share your personal journey so far and how you found the MPage so far, so that and anything you'd like to share with our attendees. Again, shall I start with you, Sami?
All right, so I can go first. So for me personally, after I finished my my baccalaureate, and it's mainly medicine and surgery, I was working at the University of Khartoum as community medicine teaching staff. So it was essential for me to do a Master of Public Health, because I need to advance my knowledge, especially in epidemiology, biostatistics, because these are the courses that I should teach. So I need to advance my knowledge in these particular subjects. That's why the Master of Public Health in particular was my main target. Then I had the confusion of either having public health or having global health. Unfortunately, in the year that I'm applying to, the system has been changed to the streams. At the past, they were 2 streams, and then they're being broken down, as Henok explained. So for me, I could do both of them at once. So I did Master of Public Health, Global Health stream, and I managed to do the epidemiology and biostatistics, which are my main target from the Master of Public Health. So this was my motive to pursue the Master of Public Health. During the master, the life-changing experience for me was the research, the dissertation. For many things, there is, like, for me personally, there are like hidden values in the research project or the dissertation. One of them is I was based in Chelsea and Westminster Hospital. My research was based there with 2 staff members. My topic was the association between deprivation, ethnicity, and perinatal brain injury. So I used to join the like weekly journal clubs and have meetings with the supervisors who are medical doctor. And then after completing my analysis, which was 1.8 million neonates, which was a huge data set, and it was a nice experience to do so. I had a chance to present my findings in a national conference of neonatology. So this is another added value in addition to the journal club and the involvement in the environment of the hospital. Beside the data analysis, I learned R during the master, which was a huge asset because back then I used SPSS, which is like for most of the people, it's obsolete, like outdated. So I learned R during the master, and then I made a new challenge to learn this data by myself to apply it on the dissertation. So by the end of the master, I had two softwares. uh, so for me, like the dissertation was like the key, and I had the chance also to apply what I've learned in the biostatistics, epidemiology, and foundation of public health in the research methods. Of course, it's the base of that. So the four core modules were all like applied directly and practically in the dissertation. Also, I was lucky enough to be selected for Geneva trip, and I had a huge passion for humanitarian work, given my country of origin and what is going there, and my experience with Doctors Without Borders. So I went there and I've seen how strategies and how things has been made at the top levels of UNICEF. We had like some lectures with UNICEF, some lectures or workshops with WHO, and some visits to the museums, especially the museum of Red Cross and Red Crescent, and we had a workshop with them, IFRC. So this was also like motivate me more to get back to work in organization and in the field. So in a nutshell, this was my personal experience, and I can say like confidently that my research skills has been improved massively, like a very very great improvement when I compare myself before and after the master. And this is because of how the master is structured and how the dissertation has been put into like real needed questions and projects.
Great. Thanks so much, Sami. Yeah, similarly, Ankita, would you like to reflect on your journey so far? Thank you.
No, absolutely. I think Sami's summarized everything very well. I had a similar experience, of course, with coming from an MBBS background and being a doctor. But like I said before, I always wanted to do this degree. However, I must say that I had certain expectations from the degree. But then now looking at the past two terms that went by, I feel like it has exceeded my expectations in so many ways that it's very difficult to to try to think and summarize the lessons. But I think I would start by saying that as I'm going through this process of, term three, we have, of course, not yet started our projects yet, which is a very exciting thing. But just the way that I think Imperial and the way this course assesses us on the learnings that we do. So this is a very different way of assessment structure that I have seen for every module, where it is extremely skills based learning, and we're actually assessed on how the skills that we learned during class. Like, it's not at all what we can remember or memorize or actually just read our module PPTs and create some output. Each module has taught a certain level of skill set, which when we go into the practical workforce is going to help us. Now, for example, if I in the future ever want to go into something of a public health consultant route or something else where I am required to write a policy brief, then the skills that are equipped from these assessments have been extremely important in informing us. And at the end of the day, we don't even then think about the grade we got or the marks we got, because we think about the skills we learned. And it's designed so well. And I think this is where the streams aspect comes in, which I think was extremely helpful, was how the streams kind of coalesce and benefit each other. I feel like the learnings from one stream could almost inform another stream, and they walk hand in hand. So I could qualify for two streams with my selections. One was global health, and one was the health policy and systems stream. And I feel like they actually complemented each other so well in terms of the learning that now looking back, I've spent the last 3-4 days after exams got over just internalizing the value of information that everyone did. In fact, we are now thinking of organizing, C1 and I, we were discussing with a few of the students that we will organize an informal gathering, like a picnic, because it's beautiful London summer weather now, where we all just sit down, and since a lot of us have taken different modules, to just sit and talk about what we felt was our biggest learning. So there's actually been a huge enriched bowl of knowledge and information that we're now kind of simmering in. And I think that's been an incredible experience. And yes, I think we've been selected, Holly and I have been selected for Geneva trip. So we're also very excited about it. I think C1's going to be headed to Lyon. So these are exciting times as well. So we're looking forward to that and answering any other questions that come our way. I think over to you, Holly.
Thank you so much. And yeah, I would agree with everything that Ankita and Sammy have said already. I think for me personally, I was coming from a like the private side of healthcare, so the commercial side, working with pharma, working with biotech companies. And I wanted to do this master's to look at kind of the broader elements that make up health and kind of take that more systemic view, while before it'd been like very focused on a specific treatment, a specific disease. And I think the program has really managed that well. So we've had very kind of high level modules available about kind of health system governance, health system development. But then there's also this very practical modules, which I think Ankita mentions a bit, but it's very skills based, very much like preparing you for the real world. And I think there's that blend I found really helpful. And I would agree that the more I kind of learn, the more I realize how the different parts of public health are kind of interlinked and come together. And I think the program has offered a really amazing learning environment for both hard and soft skills. So everything from, like, as Sammy mentioned, like the data analysis using R. I couldn't use R at all before starting. I'd never used it. And now I really enjoy it, actually. It's something that I've kind of really grown into. And then the soft skills of kind of working with teams, leadership, that's really emphasized as well. And I think also, like, surprisingly, creativity, because I think there is a creative element in kind of designing a research question or designing a program. And a lot of our assignments have been really open-ended, so we can like take things in whatever your interest is. Really, there's probably like an angle you can take to make that relevant for your assignments. And I think, yeah, it's really allowed us to kind of run with whatever we're interested in. And the cohort is really diverse as well. So it's really interesting to see the different angles different people take. We've got, people who have experience in medicine, but also people who have, like me, maybe experience in something else. And it's interesting to see how that comes together. In terms of like challenging elements, I have found it a challenging year so far. It's not over, but there's a lot of reading, a lot of like managing multiple priorities, which I think, at times has felt, difficult to keep up with. But it just, again, I guess, helps us to develop skills in kind of time management and self-discipline and definitely very rewarding as well. Yeah. And yeah, your turn.
Right. Thanks so much, Holly. Thank you. Thank you. Sion, yes,
Yeah.
please.
Okay, so what I really appreciate about the MPH program is how supportive the lectures are. And in class, during assessments, or even via emails, all the lectures or the module leaders are really encourage independent thinking and critical questioning. And I remember sometimes I email them after class with extra questions or even to challenge certain points. And every single time, they were very patient and thoughtful in replying. And they not only answered my questions, but also pointed me to further reading or gave me advice on how to deepen my understanding. And so I feel like this kind of encouragement for independent thinking has been really valuable, and both for my future professional career and academic path. And for the challenging part, before coming to study at Imperial, I actually didn't have any experience studying in an English-speaking country. So this is my very first time fully immersing myself in an international or English academic environment. And I'd say the biggest challenging for me is of course the great thing, people from different background and from different cultures and have the different discoveralized learning experiences. So it just form a really different dynamics. And that's how I feel really difficult is the class is very diverse, and most modules have some kind of group work, which means you have to collaborate and communicate across different cultures. So there were a few layers of the difficulty, like getting used to different English accents, or we all have different ways of thinking or approaching problems because of a varied background. And also we have, as Angela mentioned before, the different expectations for assignments weren't always aligned. Some classmates were job hunting and just aiming to pass, but while others may hoping for distinction for PhD applications or otherwise. So on top of that, adopting to study fully in English was hard in the beginning, but honestly, it helped me grow a lot. The teaching team was very supportive, and I could always book meetings to discuss any issues. And after struggling quite a bit with group work in my first term, I eventually adapted, got good results, and by the second term, I was able to engage in proper academic debates and work well with native English-speaking classmates. And I also realized why the school designed this group assessment, because no matter what career path you take in the future, working with different kinds of people is unavoidable. And it was very useful preparation for that. And that's it.
Hi, Sion. You done?
Yeah,
Speaking?
I'm
Yeah,
done.
thank you
Yeah.
so much. Thank you so much for sharing both the great things and some of the challenges. And I think the overarching thing is this is a 1 year very intensive program. We do try and set you up from the very beginning to follow the pace and complete all the requirements. But there's a reason behind it, right? We're trying to develop some very critical skills in the different aspects of public health. There were some questions in the chat, so thank you so much, everyone. And I'm sure there are some questions that we would like to pick up on, and we can all reflect. But there was a question around, so these projects, the research projects, are any of those published? So I'm sharing my slides. Hopefully, you can see that. So just to show you, there's a slide that shows some examples of previous publications. So this is from Tom Cowling. You remember Tom Cowling, Anthony? So
Yeah.
he ended up working at Imperial for a number of years, and I believe he's at LSHTM now, but he's an MPH alum. So this is a publication from his work, working with data set related to access to primary care and visits to emergency departments across England. And here's another example: blood pressure, hypertension, and the risk of sudden cardiac death. Then this is a systematic review and meta-analysis. This is actually a few students had worked with the same supervisor who's the last author on this project, and then they came together, joined up their efforts, and published this in a very, very key European Journal of Epidemiology. This is actually a Cochrane review. This is work I got the opportunity to involve in because I was also supporting the student during her project, Fatima Sultan. So getting your own Cochrane review is really it's really something. But this is from her dissertation, and she's gone on to develop the work. She got other Cochrane staff, as well as she joined up different teams and enabled this project to publish. So it takes your own effort as well, but the supervisors are also very keen to publish the works. Effects of exposure to tobacco and electronic cigarette advertisements on tobacco use. This is supervised by Dr. Philippos Philippidis, who's the education director. So working with a few, with the student, the first author. So if you are a student, you follow on your project to publish, you'd be the first author naturally. And this is work that I supervised. A student, Prerna, who's currently undertaking her PhD at Oxford University. And this is a different type of project where she went out to Uganda, collected primary data, qualitative study, and has published that. And there was another question around what do your students go on to do? So this is a survey we did between 2013 and 2018. I think it's about the number of respondents were about 100 something. So very not a great representation of all the students who've graduated from our course, but the indication from there is, given the focus on analytical skills, a lot of our students go into analyst positions, the great majority, management consultancies, but some would have been on the public health registrar training. If you know from the UK, you know that's a 5-year training course, so they would have done the course and have gone back. Some have gone to clinical practice, clinical research, PhD studies, and so forth. So the opportunities from a public health master's degree, especially one that is focused on analytical skills, and from a highly rated school such as Imperial. So one of the slides that we'd have covered, which we have not due to trying to focus our time on the discussion, is how, as a school, Imperial is highly reputable within the UK. It came out #1 for research power in the last Research Excellence Framework Assessment. And so when you come and study with us, you'll be part of that offering, working with different researchers in the school. So that does put you in good stead to go into analytical positions, PhD opportunities thereafter. Great. So there was another question. So just to field some of the questions back to you guys, there was another question whether there was opportunities to engage in internships, other research work outside of the course. Did you feel that was practicable over the year? I know one or two or a few students kind of managed to pack that in, but what were your reactions around? What would be your reaction around that? Anyone?
Okay, Holly, you go first.
Oh, no, you go. It's okay.
No, I just wanted to say that Holly already, I think, mentioned this, as did Siwan, that it's a very intense course. And I can say this may come as a surprise, but I've done med school, which is arguably considered a very, very intense stuff, different level of academic stress and everything. This is a very different ball game, but it's equally intense because it requires you to reflect so much on your learnings. There's so much of it is group work. And I remember Anthony and Philippos in our induction week said that it's very important for all of us to be open to group work, whether we like it or we don't like it, because in a real life setting, we're never going to be doing work on our own. We're always going to be working in groups, but people don't realize how much that actually entails in terms of the work requirements, in terms of the schedules, in terms of the ideas that happen. Secondly, what Holly also said is that you can input a lot of your own interests into the different projects we're doing. When you're automatically interested or passionate in a particular subject, then you are going to put in a lot more effort. I know some assessments took 2-3 weeks to like get to some semblance of completion or fruition, which was an immense amount of reading, understanding, and then channeling it to maybe 2 or 3 lines worth of work. So it actually is, especially for term 2, extremely difficult to do in terms of balancing, because in term 2 we have 2 divisions, right? So the first half of term 2 is 5 modules, and then 3 modules or 4 modules, and then 3 modules or something like that. So the first modules and the first half modules will have some assessments that get completed, but then will happen when you are going through the second half modules, and then it's like complete like 3 or 4 months that are very overwhelming, great learning experience, but there's a lot to do. And so I don't think there was a single day that went by when I consider myself having free time to like do anything other than just to stay on top of the work in terms of the pre-work, post-work, which is all very important to actually do a good job and to actually understand what the module leads are trying to teach you. So yeah, I think over to you.
Yeah, I would definitely second everything you just said. I do think, like, as we've kind of hinted on already, you can already start to like develop your interest through the assessments. So, for example, we had an assessment which was a literature review for the research methods module. And I think if you already have an area that you're interested in, or you want maybe your summer project to be on, you can start to research that in the literature review. And then it all kind of feeds together, hopefully nicely, throughout the year. And that can kind of contribute to your future research. I think there's also, what I wanted to add is that there are some opportunities for kind of internships with different kind of groups within the School of Public Health. So the WHO Collaborating Center offers internships, which you have to apply to, but there's some opportunities to do kind of extracurricular things. And we also run a forum which helps to organize like career chats with people working in the field of public health. So there's opportunities to kind of get involved in other things outside of the course, which might be interesting and also offer you opportunities to kind of meet different people as well.
Yeah, thank you both. And yes, so all those opportunities are there. We haven't quite presented all those very well to save time for this discussion, but I'm glad you guys have addressed those. So, there are departmental seminars that you're invited to, college-wide seminars. So you'll have the research exposure, but research internships per se, it's not about getting the variety of, in being involved here and there. It's our effort is to, help you hone the skills in research, in analysis through a significant involvement learning to begin with, as Holly said, across the different modules, you are developing all these skills, and then ultimately you are going to work on the significant project at the end, which will be a significant involvement in developing your skills. Siwan, do you want to add anything?
Oh, yeah. Can you hear me?
Yes. Okay. Yes.
Oh, yeah. Yeah. So, as for some advice on the incoming students, I'd like to add that as you mentioned before, is a very intense module. It's a very intense journey. So I say if you don't have, beside the group work, so if you don't have a background in public health, or it's a good idea to do a little bit of preparation on basic epidemiology and biostatistics or the medical statistics, because they are pretty much the foundation for everything in this field. And it will be really helpful for the MPH journey. And also don't put too much pressure on yourself when it comes to like you want to do another thing, like you are nervous about the job hunting or the PhD applications, because the course will keeps you busy. So it's important to prioritize your studies first and just to try to keep a good balance. Yeah, and that's what I want to add. Thank you.
Thank you, Sion. So there was a question around that, how much of a readiness, right? So what we want to make sure is you are, you have the quantitative competency to complete those modules, but otherwise the modules are run. If you, I say to students, if you're going to do biostatistics and epidemiology, do it here, because we dedicate a lot of time through tutorials so that you understand the basic concepts and are able to apply them. So even if you haven't done those, if you need, all you need to do is demonstrate to us that you've undertaken statistics related courses or things and are up for the challenge, right? And it doesn't mean, so we know that there are different interests at the end of the year. You could do a qualitative project, you could do different other projects, but these are the core topics within skills within public health. So we address them quite, they are a significant part of our course. There is another question around this accreditation information that we've posted on the web pages. This comes up every time. It's a disclaimer for us to say, we're not part of any accreditation scheme. Within public health, this accreditation scheme is a recent phenomenon. It's not well developed. So we haven't chosen to be part of that. So I think there are one or two, and each of them don't have more than, I think, 10 institutions or 7 or 8 institutions in the UK who've opted to go in. We haven't opted to go into those, but so they are not like a discipline-wide requirement, and we are assessing how those develop, and we might be part of an accreditation scheme, but we're not part of that. But it's not something that is a discipline standard, and we're not meeting that. It's just that it's in its nascent stages. It's just being developed, and we are following developments there. Any other questions from the Q&A anyone would like to address?
I was just going to add very briefly in the accreditation issue. I mean, as Haddock says, I mean, we looked into it, very deeply, but what what accreditation involves is very closely following what other institutions say need are the sort of skills of public health, and not being in it, as well as the fact that most masters in this area aren't accredited in a similar way. Also, not being in it, being in part of that scheme means that we have the freedom to sort of like launch new modules, which we're sort of doing all of the time, and really refine the course based on the updating public health picture and what we know and people's interests. So it's very much a positive picture, I would say. But got 3 minutes left, so we've got a few final questions, I think.
Yes. So other than the WHO, are we part of any collaborations? Yes, indeed. In different forms, we're working with the NHS trusts, the Northwest London ARC collaboration, as they call it, the Applied Research collaboration is a big conglomerate of this NHS trusts, and we get a lot of projects that are very applied from them, and they do contribute to our teaching. The UK Health Security Agency, other international organizations, consultancies, pharmaceutical companies, through academics who are at Imperial, there are all these links, and the students here will attest that our modules actually involve a lot of invited speakers. So if you came on my module second term, commercial determinant, mine and Anthony's module, basically we only teach the first 2 days, and the rest, the 3 days, are invited speakers from the London School of Hygiene and Tropical Medicine, other collaborators that we work with, other industries. So we through the 1-year platform, we aim to get you exposure to people who are engaged in cutting edge science application of the science, be it whether they are at Imperial or beyond. Any other question or any last thoughts? Anyone over the next 2 minutes?
If I can add something, it would be one of the important dimensions in the Master of Public Health at Imperial is the people. Because I was concentrating on the master itself without concentrating on the students and the people. Reflecting in my personal experience, I'm coming from a baccalaureate where we were homogeneous. We are all studying the same subject, medicine, the same people from the same country, almost the same way of thinking, and so on and so forth. But at the master, by default, you will find people coming from different disciplines, different like view to the life and their disciplines and their vision in life, and so on and so forth. And this is like it's an exciting challenge to have to deal with people coming from different backgrounds and different personalities in completing an assignment or um, uh, outside the class, and so on and so forth. So my recommendation for the upcoming students, like this is one of the things that if I go back to the master again, I will put more time to invest it, to sit with people, to discuss with them, to have a chit chat with them, to understand their lives, to understand what they're doing, what they're up to. Because this is a rich community. It's very difficult to find such a rich community of brilliant people in one place with diverse backgrounds. So this is something that I would like to highlight.
Yeah, great. Thank you, Sami, for highlighting that. And 1 year we had 25 countries represented. That may be a record, but we're thereabouts, around 20, 15 countries at least are within our cohort. So that's a unique opportunity. There is a question about job prospects. So something that was being discussed as well. So we have, career sessions that are being held. We've got the postgraduate forum that runs this. This is student-led, so they organize, supported by staff. They identify key people to come and speak to you, key industries to come and speak to you. We have the Friday weekly digest emails that we send out. So we collect, people approach us saying, we need you to send this to your students, different opportunities. So that's all compiled on the Friday. You get access to those. There's career services at the college, and Dr. Sondus Hasuna leads the career advice support at the School of Public Health. So there's a lot of support and a lot of opportunities that we share with you. Great. Yes. And finally, just to tackle this, yes, big data analysis. We've got different modules from the basics of the biostatistics to advanced stats and data science module you could undertake in the second term. And you could end up to elect and do your project with something that involves big data. I think we should call it there. We'll be sharing the slides, which will have more information that we haven't presented. I think it was great that we could dedicate time more for that, and you could hear from our fantastic students and our alum, Sami, our current and former students. So thank you so much, everyone, for sharing your thoughts. And thank you so much, everyone, for joining us over this hour. We hope to see you join us eventually. And yeah, we look forward to hearing from you. Thank you all.
Thanks, everyone. Nice to see you. Thanks.